You may have seen those ads on television lately about bladder control problems, you know, the cough and the oops moments. Well, you may be surprised at some things that are actually contributing to those embarrassing moments that you might be able to do something about. Let's start off with first the obvious. Can you catch yourself midstream? Use the restroom, begin to flow, and then clench. If you've still got some dribble, it's quite possible it is just a muscular thing, or it could be some other things. So let's take a look at the muscular area. There's a couple of simple exercises. One you may have already seen before, and that's just bouncing on the ball. But you may or may not have been actually bouncing on the ball correctly. So you want to start off with just sitting up straight, ear in line with the shoulder, shoulder in line with the hip, and just relax with a gentle bounce. You don't want to clench your stomach. You don't want to do any extra lifting motion. You just want to feel how the body down below is naturally lifting. That's the muscle that you want to be using, and it's doing it on its own. You don't have to help it at all. In fact, if you help it, you're actually interfering with it. So besides the ball, there's another thing that might be even easier, and that's using a straw. This is a technique often used with children if they can't hold themselves through the night, that just sucking from a straw builds that same action. This straw is a bit thick for natural normal liquids. What you want to do is create a little drag motion. This would be good for like a milkshake, but if I was drinking water, I'd just kind of crimp at the bend area and just suck up. And when you suck up, you want to feel that kind of lifting that is automatic down there. Don't help it, just let it lift. That's actually the beginning of that Kegel motion. Now feel the difference if you imagine yourself catching yourself midstream and the muscles that are involved with that. The sphincter gets involved with that, and that actually creates a thick bladder wall, and that's not good for the bladder. The bladder needs pliability. So when you consider the exercise, think about the lifting motion. You can do that without a straw, without a bounce, by just sucking in, pursing your lips, and just drawing in, and you feel that natural lift. Now for women, there's another thing that they can be adding into it, and that are vaginal weights. This again, another rather passive exercise. You just insert the weights as you would a tampon and allow the body to respond and just naturally hold the weight. If the weight's too heavy, they're graded. There's like graded of 5 weights here with slightly heavier weight as you go up. If you put one in and it slips out, your body's just not ready yet for that weight, so go down a step lower and adjust. And you walk around with it for 5-10 minutes and then remove it. And you do that again the next day. And eventually that muscle naturally will start to work more for you. So in addition to muscle supports, as mentioned, that you can actually hinder the bladder by creating a thick bladder wall because it wants to expand. Well, in addition to clenching, if you're a pusher, if you don't have much time, we're real busy that you can't spend 10 seconds and just let yourself naturally let it flow out, that instead you have to push it, that action too creates a thick bladder wall. So we want to avoid that. So that's like the basic obvious. There's another consideration is what kind of pressure is around the bladder. Let's start with arousal fluid. For both men and women, and men have known this already a long, long time ago, that if they're aroused, it's difficult to urinate. So if a woman is also aroused and say she is not able to climax, that fluid doesn't necessarily just kind of dissipate on its own. And if it doesn't dissipate, it kind of sits there and you're not able to completely evacuate your bladder, and you can get infections from that. So there's a couple of exercises that you can do to help with kind of moving things through a little bit. If you have pressure either from a fluid, or maybe you have pressure from you wear tight clothes or compression garments such as Spanx or girdle, these things add pressure as well as the fluid, arousal fluid does. But also if you do a lot of core work, such as Pilates, where it's really intense. In fact, women in their 30s who do a lot of core work have been known to have oops moments, just because that cylinder of support is so tight. So to help kind of relax that area and to help fluid movement, and also to not have so much compression in there, you want to start off with just bending your knees a little bit and just create a little bit of a rocking motion. You're going to start with just a simple rocking motion, and then you want to undulate the belly, just kind of stick it out and then bring it in. And it's just that kind of a motion. Remember to really make that tummy get really large when you're doing it. And you can also try belly dancing, which is marvelous for that kind of relaxing and opening up the area, and that should help a little bit with the fluid movement. Additionally, other things can be pressing against the bladder, and that's the other direction, constipation. If you're full of it, you just don't have as much room. And imagine if you cough and your bladder pushes up against something solid, it's got nothing else to do but release. If there's nothing there, it'll bounce or move, and you won't have a problem with incontinence. So those are kind of the things from the outside, but also consider what may be going in and through your bladder. As we get older, all parts of our body are starting to just not function quite at the same level they did in our 20s. If we look at our renal system acts to buffer things. And our body likes to have a pH of somewhere between 7 to 7.35, at least the area that we're talking about. And in this situation, most of the standard American diet tends to be acidic in nature. And if the renals aren't helping to buffer it and make it more naturally alkaline, that acidity is going through the urine, through our bladder. And you can actually monitor it in your urine. And how you do that is you can get pH strips at the local pharmacist, and you either can test it through a urine sample or with your saliva, and just see whether or not you do have a little bit of extra acidity. Acidity adds to inflammation, not just in the bladder, but other parts of our body as well. Other things that are adding to acidity besides what we're ingesting is maybe medication that we're on, or exercise. The metabolic breakdown during exercise or a lot of physical activity will also increases acidity. So if you've been doing exercises as you did in your 20s, or maybe even more so, and your renals aren't doing as well as they could, a change in your diet to a more alkaline diet will help to regulate that and offset what the renals aren't doing for you anymore. You can find a lot of information on the internet about an alkaline diet. Just be cautious, or put your thinking caps on about what you're reading. You've got pH strips to test. There's no reason to go overboard. Too much alkalinity isn't good, just as much as there's problems with acidity. So err on the side of just looking for balance. So in addition to those kinds of considerations that you can readily address, there's also, of course, you can have an infection, you can have an obstruction, or if you've had spinal problems, such as in the lumbar and the sacrum, the nerves to the bladder go through those areas. And if you've damaged it, or if you have some spondylolisthesis, which is narrowing, that the root can become damaged or impaired and affecting bladder control. So as always, check with your doctor. I don't know about you, but I'm 57 years old and I'm in no hurry to rush towards a pad or a diaper. There's no shame in it, but why bring it on sooner than we need to? Anyway, be well, mind your body, and you'll be glad you did.